Well, Dr. Licht, thank you very much for finding the time to talk with me about this, and congratulations.
Thank you very much, Paul. I'm delighted to be talking with you here today. Today is the first day that the University of Florida is an NCI designated center. The notice of award came 2 days ago, and June 1st is the start date.
Oh, so this has already happened. Fantastic.
So our official rollout will be on June 20th with our government officials. And that's when we're going to officially let the word out with press releases. But the grant started June 1st.
Oh, fantastic, fantastic. So this has been a journey of many years for the University of Florida. How long have they tried to do this?
Well, there's always been a great interest in developing cancer research at the university, and there have been a number of efforts. I'd say quite notable was about 20 years ago, Strat May was recruited from UT Galveston, and a new cancer research building was built, which really expanded the capability to recruit both basic scientists as well as clinical scientists, as it houses our clinical trials office as well as dozens of wet bench investigators. And it was located conveniently across the street from the major clinical facility for oncology. So some of the physician scientists could go back and forth across the street. So that was quite good. So he developed efforts, and there was some initial funding, and some of our key members were recruited at that time in the early 2000s. Subsequently, Paul Konieff was recruited from Rochester and as chair of radiation oncology, and he continued to organize the programs. And there was an interim between that time and between Dr. May, who was on the position for about a half dozen years. Dr. Joe Simone was actually here from Simone's Maxims, was here for a while to try to organize things. Dr. Konieff was in charge for about 7 years, I'd say. And then in 2015, I was recruited.
So what was the difficulty? Is it funding? Was it the institutional support? Because 20 years is a long time. Although on the other hand, VCU had been at this for almost 40. So for comprehensive though.
Right. Well, I think that one thing that really helped is that the university focused more of its resources on this. They began to understand what a large enterprise this is to bring the clinical researchers, the population prevention all together, and realizing that we really needed to go to a next level. The state legislature in 2014 passed what's called the National Cancer Centers Act, which forwarded additional funds to the University of Florida, to University of Miami, in their attempt to reattain cancer center designation, and to H. Lee Moffitt Cancer Center to continue their quite impressive growth. But the notion here of that act was to assist Florida cancer centers in becoming very competitive for national talent in a manner akin to what CIPRIT has done for Texas in terms of recruiting talent from across the country to various Texas institutions. Instead of there being a granting agency, there was money actually given to these 3 major cancer research facilities starting in 2014, leveraging against institutional resources to be able to have very attractive startup packages, money to build clinical trials infrastructure, build community outreach engagement, education and training programs, get the right shared equipment to facilitate cancer research. So this was a big stimulus, and this was a big draw for me to be able to actually execute a vision with an appropriate amount of resources to do it.
How much money is involved in that state appropriation, and how much is coming to you?
Um, well, it was about the formula is changing, but what I could say was it was about over the term of 2014 through 2022, it was about $12 million a year, uh, and that leverage against institutional things. And there may be changes to this going forward, but it was a very reasonable amount of money to try to do that. Of course, there's a lot of uses for those funds in faculty development, recruitment, retention, trainee programs. Mhm.
So you came to University of Florida from Northwestern. I think it was about 7, 8 years ago.
Yeah, I started October 1st, 2015, so a little over 7.5 years ago.
Oh, fantastic. So that would have been after that state legislation.
Right. The state legislation had started about a year and a half before. Mhm.
So
And
that
so there's
probably convinced you to take the job.
that was a big draw, understanding that there was a serious amount of fund behind the effort. I A requisite amount of funds commensurate with the job ahead. And uh, so using those funds, what we did is we recruited over 60 new faculty. Uh, Most of those were external recruits. About half of those recruits were women, and 10 of those recruits were from underrepresented groups in biomedicine. We stimulated more funding internally through strategic application of pilot funding. We incentivized and stimulated clinical research in IITs. So by the time we applied for this designation, we had uh, doubled the cancer relevant funding at the University of Florida to its now over $47 million per year, tripled NCI funding, and doubled therapeutic accruals to clinical trials. In addition, having literally thousands of non-therapeutic but interventional studies in areas such as prevention and screening.
Hmm hmm what was the heaviest lift for you?
Well, I think what I learned about, and what I've learned is my life in administration is to uh, try to understand the culture of a place and try to um, understand the different stakeholders. So I just think some of the hard work to do is to understand the culture of a place. And so I did a lot of walking around, literally walking around campus and visiting all of the different component chairs and deans we collaborate with and understand their interests and how we could work together. So I think that's the prep work, right? And I think that made things subsequently easier. I think also we had to create new executive committees and new program committees and to uh, bring people on board and to motivate them and to help them understand the mission of cancer centers. And it was there, but wasn't in the NCI way. So that was also a a lot of culture change. And but doing this by collaboration and offering benefit to members, such as rebates for shared facilities, a robust pilot program, bringing in new speakers and new opportunities for faculty to meet people in the field, offering new opportunities for trainees in their laboratories, including um, things such as dissertation awards that we helped defray some lab costs, and and travel costs for students in their final years of their PhD. So we try to show a lot of benefit, not to say this is just a structure you have to have it. We're trying to say that our structure really makes a difference to the lives of our patients, our community, and to our faculty and staff. So I think the heaviest lift is how complex the job is and how many relationships you have to manage across colleges and departments and faculty. We have 16 colleges at the University of Florida, and we've engaged with 11 out of those 16. And that's what I think one thing that makes our cancer center quite, I wouldn't say unique, but quite, I think somewhat distinct in that we really are trying to engage the whole university in this. And that's something we're very proud about.
Yeah, I keep thinking of the cancer centers, the culture of a cancer center as something that runs on leadership. And that's not really a tangible concept, but you know it when you see it. And then also, I guess, morale, and and curiosity, and the only one tangible aspect of it is money. So you must have been knocking on a lot of doors and just selling the cancer center as the leader.
Well, we also had people coming to us because they knew we had resources and they wanted to collaborate. That was useful that we have resources and we also have space. So we have serious control of research space, and we have serious resources. And people know that we're thoughtful about application of these dollars. We're not we're doing it in a very deliberate way, but that gives you a seat at the table. However, you need to match that with soft skills, right? Collaboration with people and trying to understand where some of the other stakeholders are and to try to put yourself in their shoes. We're a matrix cancer center, and that's inherently highly collaborative. We're not a single entity like Moffitt is or City of Hope or a place like that. So it's a very different structure working within the university.
You mentioned at one point that you had this golf cart to get around this huge campus of yours. That must have been.
This has been really impressive to our visitors. They really love when we bring people down for our grand rounds or our topics in cancer seminar, and we have our cancer genetics research complex building is about a quarter of a mile or a third of a mile away from the hospital area. And so it's a very pleasant walk in the winter. In the summer, you will be dripping wet in one block. So we get the golf cart out. And sometimes with my associate director of basic research, we've gone up to the chemistry department, which is about a half a mile, 3/4 miles. We take the golf cart up, we bring some box lunches from Panera Bread, and we go sit down and talk with them about how to stimulate their interest in cancer research. So we use the golf cart a lot, and the visitors really enjoy being driven around the campus and seeing the sites, and so it's been a very, very effective tool for us.
Well, you mentioned Joe Simone. Well, there's this. I ask this question really every time I talk with cancer center directors, and he said when you've seen one cancer center, you've seen one cancer center. What is the University of Florida?
I think what I'd like to say is distinctive about this is the all of campus approach we've taken. We have collaborated with bioengineers and actually mechanical engineers who are literally rocket scientists, and they use software used to count galaxies to count T cells infiltrating a tumor. We do clinical trials in therapeutic intent with pet animals, dogs and cats. At the same time, we're using that information to inform our first human clinical trials. we work with the College of Journalism. We work with the Agriculture School. So I think what I'd like to say is the University of Florida Health Cancer Center is more than the health system. It's 6 health sciences colleges and 5 other colleges working together and across disciplines to attack the cancer problem in all of its forms.
What was the hardest thing to do about bringing it all together? How did you do the bringing it all together bit? Is it different from what other centers do?
There's no rule book on how to do this. I mean, there's also been few places that have had a director step in and in 7 years get NCI designation. It often takes longer than that. And we, it was to shift the culture and to educate people is hard. It takes time. To assemble the team was pretty quick. We had that together by the beginning of 2017, and we started writing. We had put in one application in 2019, and we had gotten very close, but we had more work to do. We were given clear instructions. Some of the most challenging things are to develop effective community outreach and engagement. That is something that we've invested a lot of time and money in, and I think we've had a number of wins. And all of our centers are trying to meet the challenge of doing community participatory research, assuring that our research is informed by the needs of the region, and trying to link our scientists and community members. So that remains, I think, very hard for many, many cancer centers. So I think the issue is to really move a ship and to assemble it, and sort of that old saying, flying the airplane as you're building it, was very challenging. And we had a fairly short timeline to try to put in our first application, which was very, very hard. So we had to learn a lot. We went on, all of us who could went on site visits to other centers, visited other centers, got an effective external advisory board. I think what was hard is that we did it relatively rapidly.
What's the catchment area like?
It's 23 counties in north central Florida. We're in north central Florida, 2 hours southwest of Jacksonville, 2 hours due north of Orlando, and 2 hours northeast of Tampa. So this is we have smaller urban areas such as Tallahassee, Gainesville, where we're based, and some areas of the villages in Marion County and Orange counties, and some of the southern counties. So we have these smaller cities. We don't have a huge urban area like Miami or Jacksonville. And we also have very far-flung and somewhat rural counties. Demographically, half of the people live in these rural counties, half live in the more dense. I'm from New York City, so these are not dense compared to what I grew up with, but they are denser. We have half the people in more dense areas, and the area it has some of the highest cancer mortality rates in Florida. There remains high smoking rates in some of these counties of up to 20 to 25% of persons at last count in some of these more rural counties and more impoverished counties. And there are lots of cancer health disparities related to lack of access to health insurance, medical and food deserts, and a number of barriers to receiving care. So we have a large burden of cancer in the region, and some of the highest mortality rates, unfortunately, in the area. We're trying to tackle these. Our most proximal thing to do is to try to be sure all the patients who should be screened for lung cancer in our system, who are current patients who are in our primary care network, that we get them into screening. And we're working on a variety of techniques, including natural language processing of electronic health records, to try to find those folks and look into their records, find out who's got the smoking history that indicates they should be screened, and get them screened so we can get earlier cases. So those are some things we're doing. Also, outreach to some of the underserved communities to try to encourage better uptake of preventative vaccines such as HPV vaccines, and also piloting and trying to move to standard practice cervical swab self-testing to encourage more women at risk to get screened for cervical cancer. So those are some things we're doing to address this cancer burden in the region.
Mm-hmm, mm-hmm. What's the demographics?
Right. So the area is about 16-17% people who are Black, about 9.5, 10% people who are identify as Hispanic, and more like about 80% white. The cancer burden is predominantly in the white population, which is on average 10 years older than the Black and Hispanic populations. So numerically, there's more people who are white. There are more cases of people who are white, and those people are older. And the old aging population is going to be some of the highest in the state in the next decade, particularly with the influx of people into these retirement communities a little bit south of Gainesville, and particularly the villages. So we see a increasing cancer burden happening in the region, and something that we're also trying to focus some of our research on, the intersection between cancer and aging.
Did you have to build the COE, or was some there, or did you build it from scratch?
The community outreach engagement, we leveraged some of the opportunities through the Clinical and Translational Science Institute, and we have worked very hard to collaborate with the CTSI. We value that relationship. In fact, we have interlocking leadership in that our director of COE for the past several years was the deputy director of the CTSI. So we share some resources in terms of community participatory research. We share in assessing the catchment area using electronic health records. For example, we have the Cancer Center helps support with the CTSI something we call One Florida, now One Florida Plus, which has anonymized health records of 17 million Floridians, also people from Georgia and Alabama, and I think we're getting a partner on the West Coast. This allows you to do trends in healthcare utilization, uptake of different therapies. You could do some epidemiology with these anonymized records, and it's a great resource we've worked on together. So we built it. We built the staff in the office and the people going out to events and forming relationships with minority institutions, Black churches, other community organizations. But we started with some infrastructure already built through the CTSI.
Oh. So right now that the job is done, what keeps you up at night? What worries you the most?
Well, we have not taken any rest at all. We have had a series of intensive planning meetings with each of the associate directors, along with my current deputy director, Dr. John Wingard, and an incoming deputy director. We'll have a press release about these changes in the coming weeks, but we've been having a cabinet meetings to discuss the reviews of the CCSG, because we'll be held to those in a couple of years. What worked well, what was reviewed well, what wasn't, and what we need to do in terms of engaging additional leaders, thinking about succession plans for this, getting more diverse people into leadership, and moving forward, and what resources are needed. So we're about halfway done with our planning. We had almost a day-long session on community outreach and engagement. We had a session on the plan to enhance diversity this week. We're maybe further refining our cancer research programs to try to sharpen the themes. So it's always continuous improvement and quality. So it's also not me. I don't like do one thing and just say, oh, I'm going to sit back and rest. That's not me at all. So we're moving right ahead to planning for the renewal, and with a goal of obtaining comprehensive designation by 2033. We would like to get in our.
Which would be
we'd like to get
right. That would be
Pardon?
the soonest you can do it.
That'd be the soonest. We want to. I've told my leadership, I've told the president of the university, the head of the board of trustees, the head of the health system, that I want to set this center up so it could become comprehensive in 10 years.
Which would be great. We'll, yeah, that would be something to celebrate.
Yeah, I'm not. Yes, it'll be something to celebrate, whether it's me in this Zoom room or someone else. I'm always thinking about what can we build to last? What will be a lasting legacy for the University of Florida, and importantly for the citizens and residents of this region. I want something that's going to last for decades and decades.
Mm-hmm. Oh, that's fantastic. So is there anything I forgot to ask? Anything you'd like to add?
Well, I'm a big fan of the cancel letter. long time fan, first time caller, or something like that. But I appreciate this forum to share some of our ideas, and how to bring a group of people together. There's fantastic people in North Central Florida. Their leadership has been a pleasure to work with, and I've worked at several different academic medical centers, and each one has got its own set of things. I'd say the old saying that people want to do well by doing the right thing. I see that here in the leadership. It's been a pleasure working with them, and I believe they appreciate the mission that we're on and see the value it can add to the community, to patients in our clinics, to the future patients that will come to us for future therapies, and grateful for the support of the leadership, the faculty, our community advisory board. Our external advisory board has been sensational, and we've been very grateful for the input and for the support, and we're just delighted to reach this milestone.
Congratulations, and thank you for talking with me.